This is a small video that I'm making for Pandas Awareness Day, which is this coming Sunday. Sunday. And since Sunday is not a school day, I wanted to send it to you all right away in hopes that it finds its way to teachers and school nurses, because these are the people that need the knowledge of what Pandas is. What is Pandas? Well, you have a student with Pandas, and what does this mean? Have you ever heard of Pandas? Probably not. Well, Pandas stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. PANS is a pediatric acute onset of neuropsychiatric syndrome. So those are the acronyms, and that's what that means. But really, what does that mean? So, imagine that as an adult, one day you contract a strep infection, and this infection crossed your brain-blood barrier, and it started causing inflammation in your basal ganglia. Now, I don't know great depths about the basal ganglia, but I do know that is part of the brain that is responsible for voluntary control, motor control, procedural learning, eye movement, as well as cognitive and emotional functions. So this part of the brain is being severely affected. So now suddenly, imagine you, the adult, are tormented by these obsessive and unfounded fears and thoughts you cannot escape. You are not able to sleep consecutively with consecutive hours, like get profound sleep. You lose the ability suddenly to express yourself in full sentences. You develop motor tics that you can't control. You're aware of them, but you can't control them. And then you can't control your bladder. You start wetting the bed. You can't retain information that has just been given to you. You stop eating. You stop being social and going out. And you cannot function at work at all. Imagine that it took about 90 days for your symptoms to subside. Imagine that you would get this way every time you got a strep infection or an infectious trigger. What kind of life would that be? Well, this is what happened to your student, to my daughter, when she was 11 years old. A once confident, happy, social, straight A student woke up one day feeling extremely sad, is the only way that I could explain it. And as the days went by, the sadness became like constant worrying and obsessive, intrusive thoughts that did not let her sleep for weeks. And she couldn't even sleep for consecutive hours. It was maybe 1 hour and then crying for another 2 hours, and then maybe she would sleep for another 30 minutes. And this is what her nights were and are when she is in flare. She then started becoming very sensitive to things like light and noise and clothing. She had a dazed and confused look in her eyes with dilated pupils. I knew that something was terribly, terribly wrong. She started not being able to care for herself, to dress herself, to wash herself. She couldn't even remember which one was her toothbrush. She gave up her phone. She started developing these motor tics and having hallucinations that were completely unfounded. Then she stopped eating and started even fearing food. And then came the seizures. After visiting a therapist who couldn't believe that a week ago this had been a happy, normal child, she suggested we check for brain tumors. Due to her suddenly becoming this different child, it wasn't common. I asked her, what does this look like? And she said, really, it looks like schizophrenia, but there's no way one can catch schizophrenia from one day to the other. When we finally got our daughter tested for infections, our daughter came back with 4 different infections, one of which was strep and mycoplasma. It took 3 months to get the correct antibiotic with a private doctor because a general pediatrician had no clue what Pandas was or how to treat it. It took 3 years to get our daughter the IVIG treatment she needed. And during those years, she experienced 4 awful flares with all of the symptoms mentioned above and many others that I don't have time to mention on this video for you. She experienced school regression, loss of friendships, loss of self-esteem, and started with suicidal ideation. Pandas is often misdiagnosed as autism, OCD, schizophrenia, bipolar disorder, ADD, ADHD, Tourette's, anxiety, severe depression, oppositional defiance. Sometimes people think that they are just being teens, or that they have bad parents, or that maybe she's just a drama queen and she wants attention to herself, or simply it's just bad behavior. But I'm here to tell you that that is not the case. It is brain inflammation. You must know about Pandas because you can be a child's lifeline. If you see sudden changes in behavior in a student, as the ones I've mentioned above, please visit Aspire Network or Pandas Network and contact me, do whatever you can to be knowledgeable about the syndrome, because it could be triggered by an infection. And if it's treated quickly, we could be saving a child's life, literally. In memory of the children and young adults we have lost to Pandas, like Rose Fontanelli, Max Wallace, and Alex Venful, I make this video in hopes that it will serve one family, one child, one mother, one father who is suffering the pain of living with Pandas, of living in fear that their children will take their lives because the pain is too much. Thank you for listening to this video. And it's meant and intended for school personnel, for the nurses, and for anybody who's curious about what this is.